The other thing worth talking about a little bit is not drug related, but I thought the rectal cancer stuff was pretty informative, and just to be careful that people don't overinterpret the OPRA results, which was very interesting. Julio Garcia Aguilar on basically showing that you can do neoadjuvant chemo, and you may not need to do surgery, or you can actually have spare sphincter in a good percentage of patients. And what they suggest is you can find the patients who don't need surgery. The problem is that the study was designed to try to avoid surgery. So there was a great incentive not to do surgery, and I think you have to look at the details of the study of when the decision was made to do surgery or not. And so I'm a little, because the chemo radiation were given in different sequences. If you wait long enough, it would look a lot better. The rectum would look a lot better, and the surgeons might have let them alone. But because in the group that got radiation after the chemo, the effect takes longer to observe, and when the surgeon looks in, they may think they still need an operation. So it's I think it's a cool idea, but there's that, I think that you cannot take home that message that you can trust that result. I think that result was biased by the study design. I don't think you can do the study any other way. I'm not being critical of the study. I'm just saying that the goal was to show what they showed, and they showed what they showed. So we still need to validate that, but the field is changing. I think we're getting to the point where we will not be doing radiation or surgery or both in a fair number of patients with rectal cancer. It was done by we were one of the groups, a consortium of colorectal surgeons. Very smart, moving part of the trend to move all the treatment up front. In fact, if you looked at there was a study called Rapido from, I think, the Netherlands. It also looked at upfront chemoradiation, and so clearly the message is that if you need to get more chemotherapy in, and probably that will benefit in the long term in terms of reducing systemic spread. That's the idea. What Rapido did, which was cool, was looked at short course radiation. So you'd spend less time without systemic therapy. It remains to be seen what the final results are, but it looks like earlier chemotherapy is better for long-term survival as well. So, I mean, this is one meeting where there were many more advances than we're used to, although some of them are still preliminary, and we still need to make sure we follow through and do some validation, do some verification of the results.